All right, guys. Hey, I'm Josh from Optimize You. This is my buddy Matt.
I'm a physician assistant at Optimize You.
Yeah, we started our company, Optimize You, about 2016. Originally Revive, and now switched our name to Optimize You. But we have been growing and growing, and we just want to kind of share our story with you guys. So we started again 2016. A buddy of mine and I were playing racquetball, and figured that there's nobody in our area is kind of doing what Optimize You does. And so we partnered with some doctors and developed a great staff, and now have grown and grown and are here in Nashville. And we really want to share with you kind of what we've brought to Nashville to help you guys be more optimized, and gals, right? Yeah. So to start out, one of the hurdles we had to do and take care of was a lot of misconceptions on the most important thing that we like to talk about, which is hormones. Hormones can have a lot of different ideas that have been brought to the table over the years in different studies, and different doctors have misconceptions. So a big one is just cardiovascular disease and prostate cancer, right? So kind of what have we learned over the years about those types of things?
Yeah, I mean, for me, on the outside when you first started, I wanted to send you patients. Then I'd ask you or something. I was like, what do you want me to tell them? Right. And then so over time, I started reading about it, and I was like, oh, this is actually really good for people. And, prostate cancer used to be a thing, and you still may find someone that says, oh, that'll get you prostate cancer. But in reality, it doesn't remotely give anybody prostate cancer. It doesn't really increase your risk. And you may find a study now that says it decreases your risk for prostate cancer, as with other things too.
Sure. So we've learned that the education is key. So that's one of the things we like to partner with magazines and do events and really help educate you guys, educate the community in what's available for you and what options that you guys have. Right? Yeah. We strive to make it as affordable as possible. And that's something that we started the business founded on. How do we get that middle-aged guy who is blue collar, who can afford this, and get more of a concierge type of service that a wealthier person who can easily afford, but let's make sure we can get everybody. Everybody needs their hormones optimized. Everybody needs decreased inflammation. Everybody needs stress relief. Everybody needs stronger bones, right? Mm-hmm. Everybody needs a better libido.
That's right.
Right?
Everybody.
And so cost is so important to us that's a big factor of what we look at and really want to make it affordable to you, men, women, of all monetary, like people that can afford it, right?
Yeah, I mean, it includes a lot. It includes your medicine, it includes your visits, your service, your labs. It depends on what clinic you're a part of, but this clinic, anything in the building you can do. So the cryotherapy, the infrared sauna, you'll find a lot of those things in any city, but it's normally at different clinics. This is all in one clinic for one price. So
for one price, you can get your hormones. Labs are so important.
Yeah.
So not only are labs good for us, but we catch things, right? Yeah. So a lot of people don't have primary cares. Yeah. So it's really important that you're getting your labs work done at least once a year. Let's look at what's going on.
Yeah, so going back to the prostate issue, again, it doesn't cause prostate cancer, but it'd be surprised we find prostate cancer, unfortunately, a lot, especially the person who maybe hasn't been to the doctor in 25 years, and we draw their labs for the first time. It's not just hormones, it's your CBC, your CMP, your prostate, your thyroid, your cholesterol, I mean, my cholesterol is terrible, but everybody, gets a rude awakening with their cholesterol sometimes, and it's in our clinic when they come in to get their hormones done.
Yeah, so not their primary
care. Yeah, not their primary care. Yeah. So with cardiovascular disease, that's where we start working on that, maybe decreasing your chances for other problems.
Right. And then going back to your primary care is awesome. We love them. They're great, right? But a lot of times what they get stuck in going on lab work is what's normal and what's not normal. Yeah. So what's not discussed necessarily is the symptoms you're having.
Correct.
Right? The optimization that you're looking for. So if you're low normal, your doctor may say, well, you're just fine. You're in the normal range. Yeah. Yes, but you're having decreased libido, you're having decreased energy, you're having
weight gain,
muscle mass is deteriorating, difficulty sleeping.
Plateaus in the gym.
Yeah, all these different things that can really deter you from wanting to go to your primary care because they're just going to say, well, you're normal. That's kind of where we can step in, help you. We can have constant communication with your primary care if you want to, right?
It's easy.
Yeah.
It's easier for us and everybody if we're all on the same page, especially, if a symptom does arise, who takes care of what?
Right. Yeah, exactly. So we really like talking about why it's so important, especially for trainers, right? Yeah. So why do trainers need to be partnered with people like us? So if you're having difficulty with a patient that is having difficult weight loss or muscle gain or their energy levels or their libido issues, and they think, well, I just need to start exercising, right? Well, great, but what if they don't have the energy to get off the
Sure. They may not have the energy to get to the gym, or even if they are coming to the gym, they may do 2 weeks, 3 weeks of sessions, and they're doing everything they were told, but it's just not, they're not seeing it. They're not seeing whatever their goal is. They want to lose weight, they want to gain muscle. They may not be seeing it because they've got this secret anchor dragging them down, which is, for men, low testosterone, women, low testosterone, maybe progesterone, estrogen problem, but all of those things you can't see, and it's very frustrating if they think they're doing everything right, but nothing's changing.
Nothing's changing.
And then they're mad at themselves, they're mad at the trainer, they're
That's right.
mad at everybody.
That's right. So what do we stress? When you have a new patient, just get their lab work.
Yeah.
If you get their lab work, you're going to have a breakdown right away of what's going on.
Yeah.
Maybe they don't need anything. Maybe they're on the borderline.
Sure.
Maybe they don't need a single thing.
Yeah.
But what's amazing is they can then get their lab work 6 months later, and if they're showing great results, they're now going to be able to show them with labs
On paper,
the benefits, whether that's a hemoglobin A1C, whether that's their thyroid stabilized, whether it's their testosterone going up a little bit just from exercise, right?
Yeah.
And so you can document that and show that patient or show that client for them, hey, this is what I've helped you do.
Yep.
Right?
Yeah, and again, we like to talk about hormones, but we may find you need a thyroid problem, your thyroid's low, or you're anemic. That's why you're tired, you don't want to go to the gym. So there's lots of things that could come up. But
You're
hormones,
diabetic.
or we always circle back to hormones at some point. So
You're diabetic.
Yeah.
I don't know how many patients in the last couple of months we've found diabetic patients.
Sure, yeah.
Yeah,
So
they're not going to their primary care, and that could be the whole reason.
Ties into high cholesterol and so on and so forth, back to cardiovascular disease. So,
Right.
Yeah.
The younger guys, why is it so important for younger guys to get their hormones checked?
Well, now we see younger guys having lower testosterone than we did in the past, but some of the first symptoms for younger people, younger men, is poor sleep, poor recovery. So again, you're not sleeping, you're not recovering, your gym workouts aren't as good.
Yeah.
So
Fertility goes down.
correct. Yeah.
The longer you live with a low testosterone, the higher your risks of fertility going down.
Yeah.
Unfortunately, it's a huge epidemic. Did I say that right? Epidemic.
I think so. Yes.
In the United States,
It's growing.
right? It's growing.
It's a problem.
It's a very big problem in the United States. And instead of more doctors looking at it, what do lab companies do? They're lowering testosterone levels.
Yeah, they make it normal to have a lower level.
Right.
The lab scale normal, or lab score range for normal is very big, so
It's
it's hard not to be in the normal category.
Right. So it's important for that 20-year-old, that 21-year-old, 22-year-old, come in here, get your labs done.
Yeah.
Know what's going on.
And if it's high, it's great. You know it's high, and then in 2 years, if you have a problem, you check your labs, and if it's the same, okay, maybe it's not related to testosterone, or if it came down, okay, now it's starting.
Yeah. The chances of us starting somebody that age on testosterone, very low.
Not happening.
It's not going to happen.
Yeah.
But we tell people it's important.
Yeah.
It's important for you to know so that when you're 30, you knew what your levels were.
Correct.
At 20, at 21, at 22, at 23. And you can document that.
Yeah.
Don't rely on a doctor to take care of your health. You know, sometimes we're here to help you, but it falls on you guys as well.
Yeah.
Right?
Get your labs checked.
Right.
It's not hard.
It's not hard.
Essentially, you come here and we do it. We check literally everything right off the bat. And you get your labs; they're good. Okay, great. Do them next year.
That's
Do
right.
them the following year. And again, you don't have to do them here, but it is very easy to get them done.
And that's actually how you started with us, right?
Yeah. So
Optimize You.
I started because there was a growing list of labs that needed reviewed, chart notes. So I started reviewing labs, and that's really all I was going to do. But then I was in the building, so I started seeing patients. And then, you know, you start seeing follow-up patients, and what I thought was like, okay, great, these guys are going to be tired, and they're not going to be tired anymore. But when you meet someone that couldn't go to the gym, was gaining weight, had decreased libido, and all of those things get better in 6 weeks, 8 weeks, those people come in and give you a hug, and they bring in things. They're like, I mean, it's more than just being happy. They're ecstatic that they feel better, and they thought something was wrong with them. So that kind of streamlined to here I am sitting in the clinic doing it every day.
Marriages. I mean, how many marriages have people said, you guys have saved our marriage?
Yeah.
Whether it's, you know,
The female or the male who started, or both, honestly. Yeah.
both of them.
Yeah.
Yeah.
Yep.
Well, that's great. Love having you join the team.
It's awesome. It's awesome.
All right, Nashville, Nolensville, Brentwood. Let's take a quick tour of Optimize You in Nolensville area. Take a look at our staff. Great staff. They are willing and able to take care of all of your needs for optimization and athletic recovery. Come on. We'll come back to this area in a bit. We're going to start with infrared sauna. Love the infrared sauna for stress relief. Just getting in there, spend 30 minutes, get the benefits of muscle relaxation and get away from everything. Leave your phone out here and just take 20, 30 minutes by yourself to relax. It's an amazing, amazing thing. If you need to get going in the morning, cold plunge is awesome. This will be up and ready to go within the next couple of days. It is, think, an ice bath, but without the ice, and you're able to drop that skin temperature, decrease inflammation in your body, help with achy joints, help with any injuries, and just keep your body moving and ready to go. Next, red light therapy. Red light therapy, you can take a look at some pictures online. I won't turn it on, it's super bright. Along a vibration plate, we're going to increase your immune system by helping your vitamin D, clean out your lymphatic system, helping your bones grow stronger, decrease scar tissue, and help muscle recovery. Super excited about red light therapy. Cold therapy, another one. If you don't like the cold plunge because you don't like the water, you want to stay dry, 3 minutes in here, drop your skin temperature by about 30, 40 degrees. You're going to have norepinephrine, dopamine release, and you're going to be ready to go for the day. Decrease injuries, decrease inflammation that's going on in the body, and just kind of get you going and keep you going. Compression therapy is great for after that workout. You did that hard workout, your legs are sore, your muscles are sore, and you really want to flush all that fluid out, squeeze those lymph nodes, again, boost the immune system, and get those legs ready to go for the next day, the next squat day, the next deadlift day, and just keep you moving, keep you recovering. Semaglutide up here in the corner, great weight loss drug. Amazing weight loss drug. We're using it a lot right now. It is developed for diabetes, and we are having tremendous results. 20, 30 pounds in a matter of a couple months of weight loss, and it's very reliable and a great source for that. Here we have our practitioner's office. This is where you'll be seen for lab reviews, lab results, going over hormone optimization. What's going on with your body? You're having low energy, low libido, your mood's all over the place. You're gaining weight and you don't know why. You're exercising and your recovery is horrible, right? That's what we're going to talk about here with our practitioners. Super excited for you guys to be coming in and really looking forward to you guys come in, stop in, see what the place looks like yourself. Thanks.